atrial fibrillation is a kind of cardiac arrhythmia. Among all these different types of cardiac arrhythmias, atrial fibrillation is actually the commonest sustained arrhythmia. Atrial fibrillation is associated with a lot of risk factors, and among all these risk factors, advanced age is a very important risk factor. So we commonly observed elderly people would have a higher percentage of atrial fibrillations. Male sex tends to develop atrial fibrillation easier than female. And among different ethnicity group, and the Caucasians is actually the commonest and most prevalent among all these different ethnicities. Of course, atrial fibrillations can be asymptomatic. Among those people with symptoms, and they can develop easy fatigue and tiredness, and when they are going on exercise or exertions, they can develop the shortness of breath or chest discomfort easily. And sometimes they would have the feelings of irregularities, and we referred it to palpitation. Yes, so atrial fibrillations very often can be picked up by some investigations. And among all those diagnosed with atrial fibrillations, according to different studies, up to 30 to 40% of people with underlying atrial fibrillations are asymptomatic. There are different forms of atrial fibrillations. So atrial fibrillation can come and goes, and we label it as paroxysmal atrial fibrillation. During the period when the patient is not having atrial fibrillations, their rhythm are regular. And of course, when they develop attacks of atrial fibrillations, they would have the feeling of irregularities. Atrial fibrillation is associated with stroke. And among those with similar risk factors, atrial fibrillation people tends to have 5-fold increased risk of an ischemic stroke. The purpose of screening and detecting atrial fibrillation is we want to implement preventive strategies. People with risk factors such as diabetes, hyperpressure, or in advanced age, they tend to have a high risk of developing stroke when they develop atrial fibrillations. So these are the common group that we should consider screening for atrial fibrillation. When the patient is in atrial fibrillations, of course, we can easily detect the rhythms by pulse palpations or as simple as a 12-lead ECG. But of course, atrial fibrillations can come and goes. So this is what we refer to paroxysmal or persistent atrial fibrillation. So to make the diagnosis, sometimes it can be difficult. Strategies such as Holter monitoring, 24-hour, 48-hour, or even longer durations of Holter monitoring can help us to detect and pick up these attacks of atrial fibrillation. So very often people would have limited access of these screening or detection strategies such as 12-lead ECG or Holter monitoring. But because of the technological developments, we very often can benefit from use of these handheld devices, gadgets such as the cardiac devices help us to perform the single 1-lead ECG monitoring, and the use of Apple Watch or other similar devices can help us to screen for atrial fibrillations, because patients can very often, when they have palpitation, they can easily do a single lead ECG by just connecting to these devices. Latest blood pressure machines very often incorporated into pulse checking algorithms, and these help us to make the diagnosis or screen for atrial fibrillation. As we know, the atrial fibrillations would generate variability in pulse and also the pulse volume. So very often the pulse will be irregular, and during the attacks of atrial fibrillations, the PPG technology can actually detect the variation in the pulse by employing the reflections of the light. So basically, if you use a mobile phone with a backlight, and then if you touch it, and there is reflections and different variability. So basically, the algorithms can pick up these variability and calculate whether you have underlying atrial fibrillations. So because of these mobile apps are very easily accessible, patients do not have to purchase another additional devices such as a blood pressure machine cuff or those Apple Watch or similar devices. So they can be easily accessible, and with incorporations of these mobile apps, they can pick up atrial fibrillations or other similar cardiac arrhythmias easily. The early diagnosis of atrial fibrillation is very important so that we can implement preventive strategies. So for treatments of atrial fibrillations, it depends on whether the patient is symptomatic or not. If the patient is not symptomatic, we don't actually have to consider the rate or rhythm control strategies. But for patients who are symptomatic, we have to see whether the symptoms is brought on by the irregularities of the rhythm or just because of the rate of the atrial fibrillation, so that we can implement the different medicines or even considering of the atrial fibrillation ablations to ameliorate their symptom. But the other very important aspects of treatments of AF is the stroke prevention. We have to implement a stroke prevention strategy, namely the use of anticoagulant, and in particular the early use of anticoagulant, so that the patients can have a ischemic stroke prevented. Of course, atrial fibrillation is associated with various risk factors: advanced age, diabetes, hypertension, obstructive sleep apnea, and other cardiac diseases, cigarette smoking, and also alcohol consumption. So some of these risk factors associated with atrial fibrillation is largely preventable. By implementing a healthy lifestyle, such as if we keep healthy lifestyle and prevent the developments of diabetes by keeping a normal body weight and regular exercises, we can largely prevent some of these common risk factors associated with atrial fibrillation, so that we can prevent or reduce the chance of developments of AF.